Hi there. Today I'm going to be talking to you about MRI findings and cerebral palsy. Cerebral palsy is not necessarily the injury that has occurred, but rather the diagnosis of a movement disorder. There are various different types of cerebral palsy, and an MRI will show the practitioners what exactly happened to the brain which caused the cerebral palsy. That will help those practitioners aid in your baby's development and treatment for his or her cerebral palsy. So in various different ways, you will see brain injuries on MRI. For example, for PVL or Periventricular Leukomalacia. That is when oxygen is deprived of the brain and it affects various parts of the white matter in the brain near the ventricles. That affects the wiring system of the brain and does not allow a whole lot of movement or coordination. That's why you see quite often babies who developed PVL suffer from spastic diplegia, which is a type of cerebral palsy that affects the legs. Another finding you might see on MRI is that of Hypoxic-Ischemic Encephalopathy. That's a brain injury that affects different parts of the brain, such as the thalamus. Hypoxic-Ischemic Encephalopathy is a global oxygen deprivation incident that occurred during labor and delivery. You'll see different types of cerebral palsy with HIE. Another type of finding you might see is a neonatal stroke that can show various different parts of the brain being affected and having had tissue necrosis. And then lastly, you might see on an MRI cortical malformations, which were just abnormal brain malformations that are either genetic in nature or occurred early on during the development of the fetus. All of these MRI findings are extremely important. Your therapists who are helping you and your baby with cerebral palsy will need to know what type of brain injury your baby had in order to best treat your baby. If you have questions about MRI findings and want to know more, please give me a call. My name is Adam Funk and I am a birth injury lawyer.